Hello, my name is Chukwuemeka Elendu, and I am a Pharmacist Candidate of class of 2022, and I will be speaking to you about the medication Edoxaban, Savaysa. Edoxaban is a clot factor 10A inhibitor direct oral anticoagulant medication. Indications for Edoxaban include non-valvular atrial fibrillation, venous thromboembolism of both deep vein thrombosis, and pulmonary embolism. Patients taking Edoxaban may take it with or without food. Patients who are unable to swallow the tablets may crush them and mix them with applesauce or 60 to 90 milliliters of water and must administer it immediately. Common side effects of patients taking Edoxaban include hemorrhage, skin rash, gastrointestinal hemorrhage, urethral bleeding, vaginal hemorrhage, abnormal hepatic function test, epistaxis, and pharyngeal bleeding. The mechanism of action for edoxaban is through it being a selective factor 10A inhibitor, which inhibits free factor 10A and prothrombinase activity, inhibiting prothrombin-induced platelet aggregation. Inhibition of factor 10A in coagulation cascade reduces thrombin generation and thrombus formation. The formulation for edoxaban is an oral tablet that comes in the strengths of 15, 30, and 60 milligrams. Patients taking edoxaban for non-valvular atrial fibrillation to prevent stroke, systemic embolism may take edoxaban at 60 milligrams once daily. Those taking it for a PCI stent intervention may take 60 milligrams once daily, along with an appropriate antithrombic regimen, including clopidogrel with or without aspirin. Those taking it for venal thromboembolism, such as deep vein thrombosis and/or pulmonary embolism, may take it orally after at least 5 days of initial therapy on a parenteral anticoagulant transitioning to edoxaban. Those over the weight of 60 kilograms may take 60 milligrams once daily. Those under 60 kilograms may take 30 milligrams once daily. If the thromboembolism is provoked, they may take it for 3 months, as long as the provoking risk factor is no longer present. And if it is unprovoked, they must take it for at least 3 months, depending on the risk of VTE recurrence and bleeding. Patients with renal impairments taking edoxaban for non-valvular atrial fibrillation with a CRCL of 95 milliliters per minute is not recommended due to increased risk of ischemic strokes. Those with a CRCL between 50 and 95, no dose adjustment is required. Those with a CRCL between 15 and 50, oral edoxaban 30 milligrams once daily is recommended, and those with a CRCL below 15 is to be avoided. Those taking edoxaban for deep vein thrombosis or pulmonary embolism with renal impairments and a CRCL above 50, no dose adjustments are required. A CRCL between 15 and 50, only 30 milligrams once daily is recommended, and those with CRCL below 15, it is not recommended for them. Patients with hepatic impairment looking to take edoxaban, those with a mild impairment, such as Child-Pugh Class A, no dose adjustment is required. But those with mild to severe impairments of Child-Pugh Class scores of B and C, use is not recommended. Monitoring parameters for patients taking edoxaban include renal function and CBC tests prior to initiation when clinically indicated and at least annually in all patients. Routine coagulation testing is not required or necessary for those taking direct oral anticoagulants such as edoxaban. Coagulation tests such as PT, INR, APPT cannot definitively exclude the presence of clinically relevant serum concentrations of the medication. To best approximate the drug efficacy, use of recent creatinine clearance and time since the last dose was ingested is usually sufficient to assess the anticoagulant effect.